guys, my name is Kaylee Shalafely, and I'm going to be running over a few exercises and the use of an incentive spirometer to take care of a post-abdominal surgical patient, so to prevent them from getting pneumonia. So basically, whenever a patient goes under anesthesia during a surgery, there's a potential for a mucus buildup in the lungs and the throat, and that could cause pneumonia. So what we're just going to do today is just run through quick coughing exercise, splinting exercise, and the use of an incentive spirometer, monitoring oxygen levels and paying attention to your pain levels, just to prevent pneumonia, because nobody really wants to get sick in the hospital when they're trying to recover. So the first kind of technique we're going to use is coughing, and this isn't your normal coughing. This is a forced cough, and it's a little bit better than like clearing your throat to get rid of mucus. So what you're going to do is you're going to sit flat, and you're going to take 2 deep breaths, and then you're going to take a 3rd deep breath. And on your 3rd deep breath, you're going to kind of hold that for 3 to 5 seconds. And then after that, you're going to force yourself to cough 2 or 3 times without taking a breath in between each one. And then after that, you're going to repeat it, but I'm just going to go through it once to show you. So here we go. So again, that's just kind of forcing myself to cough and forcing that mucus to dislodge and not build up to cause that pneumonia. And that's, again, better than clearing your throats. That's just one of the exercises. The second exercise is called splinting. And for this one, I'm going to need to use my pillow. And since I am playing the fact that I'm taking care of a post-abdominal surgical patient, I'm going to be resting it up against the incision site, which is on my stomach. So what you do is you're going to fold your pillow so that's resting up against your incision site. You're going to kind of put it tight, and then you're going to take a deep breath so that you can feel tension up against the pillow. So then when your chest is filling up with air, you can feel it pushing against the pillow. And then after that, you're going to breathe out so that you can feel the air kind of deflating out of your lungs, and you'll feel it pushing up against the pillow. So the deep breath, you're going to feel it tensing up against you, and then you're going to feel your chest deflating when you're done. You're going to repeat that a couple of times. All right, so here we go. And I forgot to mention on this one, whenever you're exhaling, you're going to want to purse your lips a little bit so you can force that air out of your lungs so it can fully deflate. So that was splinting. The third thing I'm going to be going over is the use of an incentive spirometer. And since I don't have one today, I'm just going to kind of play make-believe. So I'm not sure how many of you have seen an incentive spirometer, but it's one of those little things that you inhale and you're trying to keep the little level thing flat and not moving as much. Or you're trying to keep the volume the same the whole time while you're doing it. So what you're going to do is you're going to take your incentive spirometer and you're going to put it up to your mouth, and you're going to put your mouth on the mouthpiece, and you're going to inhale. And you're going to try and keep that same level of inhalation the entire time. Try and keep that little knob staying where it is. You don't want it to waver too much. You want to kind of stay where at the same spot. And you're going to do that, and you're going to breathe it in. You're going to try and hold it at your desired sweet spot for about 3 to 5 seconds. And then after that, you're going to exhale slowly. And then you want to do that about 10 times, but you want to take a short rest in between each time. And then you're going to do that as much as your care provider asks you to do or wants you to do. So there's coughing, splinting, and the incentive spirometer. Also, throughout the recovery of a post-abdominal surgical patient, you're going to want to monitor the pain levels. So you're going to ask them consistently, the normal between 1 and 10, what's your pain level? And depending on that, whether it's in their chest, where the pain is throughout the body, you're going to do either different exercises to prevent that mucus buildup. You're going to give them different medications, whatever you can do. You're going to talk to your doctor about it. You're going to do whatever is possible to keep their pain levels down as they're recovering. I mean, there's always going to be a little bit of discomfort. I mean, nobody's going to be 100% comfortable during their recovery process, but our goal is to keep you as comfortable as we possibly can.